Hello, everyone.
Hello, ladies and gentlemen. Please bear with us. We'll start shortly. We'll give us about a couple more minutes, and we'll get started shortly. Ladies and gentlemen, at this particular point in time, we'll get started to get the ball rolling, and we'll start with our moderator for our coordinator for the program, Mr. Moses Bai, who will introduce the moderator. Mr. Moses Bai.
Yep. Good evening, good afternoon, good morning, ladies and gentlemen, depending on wherever you might be on the globe. I welcome you all to the first of a series of webinars that will be held by Grant. This webinar today will focus on building and sustaining a world-class health sector in Sierra Leone post-COVID-19. My task is to introduce our moderator. Our moderator is a Sierra Leonean who is currently living in Cuba. He holds a PhD in English linguistics. He's an assistant professor and the director of the Masters in English Studies at the University of Cape Verde. He's a founding member of Grant. He's a fine gentleman. And ladies and gentlemen, without much ado, I introduce to you Dr. Saidu Bangura. Dr. Saidu Bangura, everybody.
Thank you very much, Mr. Moses Baikonte, for this introduction. And thank you also for putting this webinar together and for inviting this very brilliant panelists that we have here today. Now, before introducing our panelists, I would first of all like to say a big thank you and a word of appreciation to our global Grand Chairman, Dr. Roland Cole. And I would also want to say a big thank you to Mr. Leslie Kuruma Sr., who is our techno-savvy man, who is putting all of these things together. And he always likes being in the background, ensuring that Sierra Leoneans and other people get to know what Grant is doing, not only through Grant Radio, but also through many other platforms that we have been reaching out to Sierra Leoneans and other people around the globe with regards to what's happening in Sierra Leone. My task here today with regards this first webinar, as the coordinator puts it directly, this first webinar in a series of webinars with reference to Grant's participation in the development of our country, is to moderate a very brilliant group of Sierra Leoneans, both home and abroad. I have been fortunate to meet one of the panelists, but we shall get to that when we get to the point of introducing our panelists. I just want to say a word or two with regards our attendees. Would appreciate you participating through the chat forum. You can send in your questions right through chat. You can also silent or mute your microphones so that at least we cannot hear you from the background. We just want you to send us questions, but I'm at the tail end of the program. Let us try to get to know who our panelists are. Of course, we all know the topic of discussion. Our topic for this first webinar is building and sustaining a world-class health sector in Sierra Leone post-COVID-19. Well, I can see on the screen there, we have three of our panelists. We are still waiting on the fourth panelist, but I'll go on to introduce the panelists that are already present here on the forum. We have Dr. Mamadou Balde, who is a medical officer in charge, infectious disease unit and isolation unit at Connaught Hospital, president of the Junior Doctors Association of Sierra Leone 2018-2019, is one of Sierra Leone's 100 most influential youth. Thank you very much, Dr. Balde, for joining us and for your, accepting our invitation to participate in this first webinar. Our second panelist is Professor Alhaji Njai, who is an internationally recognized technical leader, thought leader, research and development senior scientist and team leader, and a Pan-Africanist scholar. He is a professor of immunology, infectious diseases, and environmental health at the College of Medicine and Allied Health Sciences and Frobe College, University of Sierra Leone. And he is also a research fellow at the University of Wisconsin-Madison. Together with colleagues at UW-Madison, his research program has led to the development of a novel Ebola vaccine and expanded surveillance for known and unknown infectious diseases of epidemic concern in Africa. I am just taking a bit of our panelists. It's actually a very huge task that I have here. Professor Njai is the founder and chief strategist of Project 1808, a US and Sierra Leone nonprofit organization focused on technical capacity in all fields, empowering young people and communities through school, community, university partnership model. I'll move on to, so welcome Professor Njai, and thank you for accepting our invitation.
Thank you for having me.
Right. I'll move on to Dr. Charles Senesi, as we have it in the German and Switzerland tradition. I'll explain why I refer to him as Dr. 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 Senesi is a medical doctor, was trained at the College of Medicine and Allied Health Sciences, University of Sierra Leone. He has lived for almost 2 decades in Bern, Switzerland. He holds a PhD in international health research from Trident University, United States of America, concluding his second PhD public health epidemiology from Walden University, United States of America. Well, this is the reason why I refer to him as Dr. Doctor, because in the Northern tradition, the North of Europe, when you hold 2 PhDs, you're referred to as Dr. Doctor. So I have a bit more to say about Dr. Nels Charles Senesi. He's a lecturer of dermatology at postgraduate level, Faculty of Sciences and Education, University of South Wales, Cardiff, United Kingdom, and also lecturer of dermatology, Department of Internal Medicine, College of Medicine and Allied Health Sciences, University of Sierra Leone. Before leaving Sierra Leone, he lectured dermatology in the Department of Internal Medicine, College of Medicine, University of Sierra Leone. He was deputy head of College of Medicine admitting team at the Connaught University Teaching Hospital in Freetown, director, Vendel Community Hospital in Freetown, Sierra Leone, and dermatology clinic in private practice. In Switzerland, Dr. Charles Senesi has a lot of responsibilities, both as an academic and as a medical doctor. That apart, is also a consultant for World Health Organization headquarters in Geneva, Switzerland, for several project initiatives. Currently working in Switzerland as a physician for the Swiss federal government in the regulation of clinical trials locally and internationally. He is founder and president of UN ECOSOC, accredited Afro-European Medical Research Network that brings together health practitioners in the diaspora to serve people in hard-to-reach villages and towns all over sub-Saharan Africa. It is in this perspective or context that I met Dr. Charles Senesi here in Cape Verde when he came here a year and a half ago And in 2019, he was awarded the USA International Forum on Advancement in Healthcare 2019 Top 100 Healthcare Leaders Award. He has been featured together with past President Obama, Reverend Jesse Jackson, Oprah Winfrey, and others in the book called The Most Influential Contemporary African Diaspora Leaders. This you can find on his webpage. So, ladies and gentlemen, please help me welcome Dr. Charles Senesi, and thank you for accepting our invitation.
Thank you very much, Professor Bangura, for having me. Thank you also for the short words of introduction.
Thank you very much. Now, we're going straight to the discussion. But as you can see, we have very limited time. We have 90 minutes all. Finally, we have Madame Nicole. Let me just say a word or two for our panelists. Madame Olufemi Claudius Cole, thank you very much for accepting our invitation and for leaving all the things that you have to do on the weekend to participate in this first of a series of webinars that we are directing with regards development in the health sector in Sierra Leone. Madame Olufemi Claudius Cole is leader of the Unity Party in Sierra Leone. She is a nurse by profession with a wealth of experience in the health sector. Welcome to our webinar.
Thank you. Thank you.
All right. Now, to kickstart our webinar today, I'm hearing some noise at the background. I'll just want to admonish to all our panelists and participants or attendees to please mute their mobile phones and other gadgets so that at least we can hear ourselves while this discussion is going to start in a minute's time. I just want to thank our panelists for a discussion point. Of course, I'll be timing you. We are going to begin with the first rounds of discussion. We are going to begin with point number one, which is your personal working in the health sector in Sierra Leone. I'll give each of you 3 minutes to bring out your, to explain to us your experiences in Sierra Leone working in the health sector. Well, as I say, health is wealth. 2019, 2020, late 2019, early 2019, we have witnessed a pandemic which has affected not only the socioeconomic development of countries, but also it has affected our health infrastructure and our health systems. It has equally affected our food security, but our discussion today is not going to be directed on that. Our direction is actually based on building a world-class health sector and how we can sustain this sector in Sierra Leone. So our first point of discussion is I want to ask our panelists, and I want to begin with Madame Femi Cole, to explain to us in 3 minutes our experience, personal experience, working in the health sector in Sierra Leone. The floor is yours.
My experience is going to be confined basically to the private sector. And for me, it's working here in Sierra Leone. And my first emotion, I can say, is one of, in many cases, frustration. Frustration in that very simple, basic things become an issue. And cases that you see, patient cases, diagnosis, and treatments, in some cases, which should be an order of the day, become very complex issues, either because of finance or because of unavailability. And I mean, something as simple as a blood transfusion. I've had cases where I have personally gone to the bank to donate for a patient in our clinic. So I think the basics, some lab tests that you may want in an urgent manner, you cannot have. Sometimes a treatment option that you may want for your patient is unavailable. And you actually, in some cases, watch your patient deteriorate because of a lack of that medical infrastructure that you need. We've had so many patients whose issue have been dialysis, and we've actually lost a patient or two because of the constraints and the unaffordability of having their dialysis. So for me, it's putting those basic things in place. Some cases, it's a particular lab test you may want. In some cases, you want a particular expert to give you an expert opinion on something that you probably have to call abroad, or you have to hang heads for you to get that. It's not at your fingertips. And for me, those are the basic foundations on which we can build the fantastic medical system that we want, is taking care of those basic things. I remember my very first incident I had. My sister, who's a physician in our hospital, was away, and we had a lady in labor that all the indications were she had a placenta previa. And I thought that was an emergency, where I was trained, that's an emergency, but it wasn't treated as such. I mean, we're talking about 10 years ago, but it wasn't treated as such. She wasn't taken to surgery till the following day. And I was totally frustrated. I even went with her to the main hospital. So for me, I think we have to really focus on our basics. And the lack of basics is where my frustration comes in, where you need, I mean, all you can get is either lactated ringers or a normal saline. Sometimes you may want the patient on something else, and you're looking and it's unavailable. Sometimes it's a particular drug that the patient might need, and it's unavailable. And I think moving forward, those basics is the foundation. Get the foundation strong, the building will be strong.
Dr. Saidu, our moderator, sir.
You please unmute your mic, Dr. Saidu.
Right, thank you very much, Mr. Moses Baikonte. As you said, your frustration is actually on the basics, the lack of medical infrastructure and equipment. These are your frustration vis-a-vis your experience in Sierra Leone. We are moving forward to Dr. Balde. Dr. Balde, your personal experience working in the health sector in Sierra Leone, please.
Good afternoon, good evening, once again. Thank you, sir, for that brilliant introduction. I'm very grateful. So I've been privileged to be in Sierra Leone for the past 4 years now, working. I've been able to work in both the private as well as the public health system. And when I came to Sierra Leone, having started at commerce and then graduated out of commerce and then returned home, I was privileged to meet with some very young, vibrant doctors who were pushing for a remodel system in Sierra Leone. So I was very fortunate to be among those leaders, I would say, fighting towards bringing a change. Back then in 2016-17, I did not actually grasp the full concept of what the healthcare system looked like until now. But I think as time progresses, I've been able to digress some of the issues we have at hand. And I'm currently serving as the president of the Junior Doctors. We've been able to do some advocacies and not just put issues to government, but at least give suggestions of how we think things should be. So having a background in a foreign country as a medical student and coming back home, and now we have the COVID, and being one of the doctors in the main tertiary hospital, I think what I've been able to gather so far is the fact that it's not about just about infrastructure. It's not just about medications. It's not just about, I think the main problem lies wherein the personnel have to find their way to get things done. The issue with that is if you have groups of employees and they are not taken care of, you leave them to the point that they have to take care of themselves. And when that happens, it doesn't matter whether you have a good hospital structure, it doesn't matter whether you have all the medications. They're looking out for themselves. That means they have to find ways to survive. And we understand the culture in Sierra Leone wherein, as your healthcare personnel, much is expected from you. I mean, from the financial sense. It means if you come to the hospital and you're going back with not much returns to your family, it puts you and the job in some kind of a compromise. Working in an emergency hospital, which is an NGO assisting the government, you look at the way the policy is set. Working at Choitrams, which I've had the privilege to, or working at the Aberdeen Women's Center, these are all non-governmental hospitals that provide free care service with no returns. But then when you work in the government system wherein you see out-of-pocket payments by patients, then very little is given. But then when you take the aspect of the personnel serving, these are the same personnel we have in Connaught, these are the same personnel we have, for example, at emergency. But the level of care being provided is quite optimal. So in a nutshell, what I would say is the healthcare system in Sierra Leone needs us to sit down and actually assess our manpower, our human resource, because I think there's lots already in it, but we have to harvest and give the best to the patient. Thank you. Can you please unmute your audio, sir? The audio is mute.
Okay. Sorry. Thank you very much for that. You've given us your own experience, having worked in both the private and the public sector, and having been an advocate to government with regards personnel and what it takes to actually be a medical doctor in Sierra Leone. Thank you for that. We are now moving forward to Professor Njai. Are you there? Since Professor Njai is not available. Dr. Senesi.
Thank you very much, Professor Bangura. And thanks to my other two panelists for elaborating on their experiences, which is not more different from what I have experienced as well. As you said earlier on, I trained in Sierra Leone, and from my days as a medical student, I realized the issues. And even as head of the student union, and then later on, we as students organized ourselves and we realized that we had to tackle issues from the ground. So we used to have mobile clinics from Freetown to the villages in Sierra Leone, similar to what I'm doing from Europe to all over sub-Saharan Africa. And those experiences we had in those villages, coupled with the experiences I had working in the teaching hospitals in Sierra Leone, lecturing as well, they were like my call to action. The frustrations I felt in the hospital, in the villages, those are what inspired me and propelled me forward to gain more knowledge and help a greater part of Africa. As Madam Cole quite said, it's quite frustrating. But those problems she highlighted are not only unique to Sierra Leone. I work all over Africa. And the problem of most African countries in terms of healthcare delivery, we are all having the similar problems. It's only the magnitude that varies from one country to the other, which is why I told my international community today that we are discussing Sierra Leone, but we can use that as a template, because working anywhere in Africa, it's almost always the same. So therefore, my young colleagues who Baba Mamadou said, it's frustrating as well. I could feel your experiences even when I was Secretary General of the Medical Dental Association. We have to grapple with government, etc. But at the end of the day, it's the passion for the job that actually propels you forward. So those experiences you're feeling, they should serve as an action point for you to go further and help more communities. which is why this webinar is not only limited to Sierra Leone. I have a whole international community listening. Let it be the call to action for Africa and for Sierra Leone in particular. Those experiences, working, those frustrations is what propels you to action. Thank you.
Thank you very much, Dr. Senesi, for this very brief experience. And I take your last point first, which is the call to action, right? Not only for Sierra Leone, and as you rightly put it, this webinar is not only for Sierra Leone, right? It's also for all of Africa. And we can see your experience right from your student days up to now have shown us that advocacy and working for the common good and for the grassroots, as you hail from the grassroots, is very much paramount and very much important in the development of any area of expertise. We are calling now on Professor Njai. Are you there? Professor Njai? His mic is on mute. Professor Njai, are you there? Well, I think we can move forward. Whenever it comes back, we're going to get back to him and see how he can explain his experience. For the three panelists that have already spoken with reference to their past experience in Sierra Leone, we're now moving forward to the state of our current healthcare system. What is the state of our health system? We begin again with Madame Femi Cole.
Well, as I'm saying, my views and stuff, I'm really focusing from our situation as a private entity. But then as a citizen, we look at the health system in Sierra Leone and we ask, are we really delivering? I know there are plans afoot for us to have a really big, massive, state-of-the-art hospital. But we look and, you know, listening to Dr. Balde, the things that you didn't say are things that I hear a lot of. And that is, in order for people to put their lives at risk, especially in this COVID, they have to be well compensated. And so far, the doctors have not been. You have to take care of your doctors, for your doctors and your nurses to be able to take care of the patients. And in that, we're talking about their compensation. We have patients who complain that when they go to the hospitals, they then have to be given a shopping list. They have to buy their cannulas, they have to buy their drips, they have to buy this, they have to buy that. And in most cases, the nurses will then be the ones selling these items. Well, if the hospital is well stocked, if the hospital is well organized, if there are supplies for them to work with, if the nurses and doctors are well paid, that's what doctor was talking about. If they're well compensated, and somebody in the society will think, well, you're not doctor, you get money, you forget motor car. No, the doctors are actually cash-strapped themselves, and promises are made constantly to them, and nothing. There's no follow through. And it's fine to say you can, Dr. Senesi, you can use your frustration to motivate you, but then the government has a responsibility too, to put things in place to make the doctors really be able to be motivated to do what they need to do. One is their financial compensation, and the other is the environment in which they're working. And when I talk to patients, the feedback I get is when they get admitted to some of the government hospitals, they want to get out of there as quickly as possible. It's the way you go there, and you go die. So the public's perception is that the care that is being given is very much on an individual basis. You might be lucky and get a good nurse, you might be lucky and get a good resident, you might be lucky and get a doctor who runs on his patients, but there's no motivation there for them to excel. The circumstances under which the patients are going and what they're receiving could be improved if we begin with the foundation, strengthen the foundation, encourage the training, encourage the supervision and monitoring of the supplies and everything in the hospital. And then, I mean, for every other place, it's a constant learning on, I mean, I watch, even when we have some new nurses, the way and manner of interacting with the patients sometimes leaves a lot to be desired. So we have to focus on the training, on the delivery, because we do have excellent doctors. We have excellent nurses. But I think again, it speaks to some of the basics in terms of as we deliver. And if people are handicapped in your health system, how on earth can you expect them to be able to deliver quality care to the patients? If this noddy, then they noddy, this is not working. Our patients are being sent out to private labs. You can't trust what you're getting in the main hospitals. Again, it speaks to a lot of frustration that they are working with. And if we in the private sector are complaining, I mean, when we catch a cold, they in the government must have double pneumonia. So I think we're not having a good image to a lot of patients in terms of the quality of the service that they get. And you still feel like if you don't have money and you can't pay, you're going to get substandard treatment in some cases, not in all. I may be wrong. Dr. Balde could probably address that better than I could.
All right. Thank you very much, Madam Femi Cole. We have seen that the state of our health system and your experiences, both in the private sector and those in the public sector, go in the same direction. That is lack of compensation for the professionals working in our hospitals or in the medical field. The working environment is also not very much conducive. And of course, all of these go towards the lack of motivation with regards to those that work in the health sector. Now that we have Professor Njai, I'll give him double time. I'll give him 6 minutes to give us, number one, we want your personal experience, Professor Njai, as somebody who has worked in the health sector. And we also want you to give us the state of our current healthcare system in Sierra Leone. You have 6 minutes. Within those 6 minutes, give us those 2 points, right? Number one, your personal experience, and number two, the state of our current healthcare system. The floor is yours.
All right, thank you. All right, thank you very much. Sorry, I'm having connection issues. I'm right up at Kabbalah in Penadugu, and so I'm having a lot of difficulties. But I'm very happy to be part of this panel. I have been involved on the healthcare aspect in Sierra Leone from the way before Ebola. Bringing in students from the US and my public health students and global health students and students with the College of Medicine and Biological Sciences in Sierra Leone. I think one of my challenge I've had in Sierra Leone is, the fundamental aspect of just the research culture among, health professionals and health practitioners, and building, a sort of a health a research base and biomedical research base is a very strong foundation that is important in terms of strengthening the healthcare. We've been involved, for instance, on Ebola since 2014. And, and throughout that period, I go to like the Ministry of Health and even talk to people. People seem like, okay, they don't even really care about some of the findings we are trying to find. They don't even try to kind of understand how it translates back into the clinical aspect of things. And we also need to begin to understand health from a very holistic perspective in Sierra Leone. Whole health from understanding, both the, building, research that goes into the lab capacity, but also research that goes into the social determinants of health, like, understanding it from an anthropological point of view, from a very cultural point of view. What are the environmental determinants of health within the country? because to build a very strong world-class health system in Sierra Leone, we need to begin to look at health from a system. And that system then involves the clinical aspect, it involves the lab aspect, it involves the social aspect, it involves aspect of even nutrition, food security, it involves the mental aspect of things. So we also have to diversify the disciplines, the understanding of what health is. And also, I think one of our fundamental things that it's not just for Sierra Leone, but across Africa, is how do we bridge the indigenous knowledge in terms of health systems with some of the biomedical training that we are getting. So much of our training has been, is very, very good. We are getting the standard European standard, Western oriented medicine. But do we also then begin to bring in aspects of our, traditional health systems, like understanding you are here as a Sierra Leonean doctor, are you trained in pharmacognosy, that is more dealing with ethnobotany, our own traditional medicines, our own systems of medical raw materials that are here. So for instance, we are faced with a pandemic right now, and many parts of the world are trying to offer solutions. And one of the things that colleagues, myself and some colleagues in Nigeria are trying to look at in terms of research is actually looking at a wide range of herbs that we have, working with, trying to work with some herbalists, trying to work with different people, and then using that in the lab, and then finding out, okay, what are the efficacy around those? Are they able to kill virus? Are they able to do something? So I think we have to reorient again our thinking around health and around medicine, and how do we actually even treat our people? When you go to, when you are dealing with a community where the people haven't even gone to school, haven't had any form of Western education, how do